Hi, it's This Week in Psychiatric Nursing from PsychWise. I'm Cassie Powers, and today is July 9th, 2026. First up, I'd like to take a look at a review that looks at how many patients are using AI for mental health support. Then I'd like to look at another study on Medicaid reimbursement and serious mental illness. Then a policy update regarding federal education policy. And finally, another research study, school peer groups, and how they may influence teens' risk for psychiatric disorders. If you're new here, I'm Cassie. I'm a psychiatric nurse practitioner in Portland, Maine, and I bring you every week a brief summary of news, policy updates, and research findings that affect the work we do in behavioral health nursing. I do this because I want to include a range of reputable sources in order to keep you abreast of developments that affect your practice, all in 10 minutes or less. A quick reminder that this video does not constitute medical advice. It is for educational purposes only. Let's start with looking at the research into patients and how they make use of AI. This probably won't come as a surprise to very many people, but new research reports that about 27% of AI users report using AI for mental health support. So, this study looked at people who were already using AI and asked what proportion of them are also turning to it for mental health support. So, it was not a study that was looking at the general population. I just want to highlight that limitation there. But the study authors, and this is a review, found that the estimates on AI use are just very inconsistent, and this has to do with study methods. So the authors are calling for more standardized approaches to measuring AI use in healthcare for future studies. So this matters for psych nurses because more patients are going to be using AI between appointments. So this can influence how their treatment goes. And psychiatric nurses need to consider asking about AI use during assessments, at least in part to assess the safety and accuracy of the information that people are receiving. Also, to reinforce that AI is not a substitute for professional or emergency care, and also to document that AI is being used and to include digital health as part of psychoeducation with our patients. Let's move on to Medicaid reimbursements and how they may impact serious mental illness. A new analysis found that states with higher Medicaid reimbursement for psychiatric care were associated with lower healthcare utilization and lower overall healthcare costs among people with serious mental illness. So, the bottom line here is that payment policy can directly influence patient outcomes. So, this Medicaid study is observational, so it identifies associations rather than proving causation. I just want to highlight the limitation there with this study. Let's take a look at the policy update regarding federal education policy and how that could affect nurses. Let's move over to workforce financing and federal education policy and how that is going to affect psychiatric nurses. So, recent federal education policy changes are affecting graduate health professions, and they continue to generate discussion. So, as of July 1st, the federal government has limited how much money students can borrow to go to college or pursue a graduate degree. For nurses, this applies to advanced nursing degrees, so PhDs, DNPs, and Master of Science in Nursing. So advanced nursing degrees are now quote unquote professional and not quote graduate degrees. So what this means, according to a recent article from ONS, this means that students who want to pursue a master's or doctoral level nursing degree would only be able to borrow half of the federal loan amounts that were previously available. So this has significant implications that could influence education financing and the future workforce for nurses. So this is not psychiatry specific, but this is relevant for behavioral health nurses because anyone who is thinking about an advanced degree will be impacted by this policy change. So nursing shortages along with nursing professor shortages could be exacerbated by this policy change. Let's move on to our final look at a study about teens and their peers and the impact on their mental health. This study took a look at school peer groups and how they may influence teens' risk for psychiatric disorders. So, we all know that teenagers are especially susceptible to peer influence during this period of their lives. So, this study wanted to take a look at how that effect might play out on mental health. So, peer networks, particularly in school settings, may influence mental health risk during adolescence. That's what this study found. So, this study comes from a nationwide cohort study. It was conducted in Finland and it looked at over 500,000 teens, and it found that peer networks may influence early psychiatric vulnerability, both through direct exposure to peers' mental disorders and via the peers' genetic predispositions. So the study found that being around peers with a diagnosed mental disorder was associated with a higher risk of developing the same disorder, suggesting a form of social transmission. So, this association popped up most prominently in mood and anxiety disorders. But the good news is that these findings may lead to new interventions which target these peer influences. Let's do a quick recap. Patients are likely turning to AI for mental health reasons. Medicaid reimbursement rates inversely impact overall spending for patients with serious mental illness. It's going to be harder for nurses to borrow money if they want to get an advanced degree. And a study looked at teens' disorders and how they may be mediated by their exposure to their peers' disorders. I hope you found this update helpful. Please consider sharing it with a nurse in your life. That's it for this week in psychiatric nursing from PsychWise. Thank you so much for being here. Let me know if there's a topic you'd like me to cover in my next episode. And of course, any questions or comments are welcome. Please post them below.